That one, okay.
Neck pain on the right side, and I don't know if it's actually back pain. It's definitely, it rings through my rib cage. I can't tell if it's my back or if it's something else, but mainly that right side. I do a lot of like catching in the gym, so the kind of muscles that hold stuff up pull on things, I think. And that's where I see the pain usually.
Okay, so let's go back to the gym. You're catching, what does that mean, medicine ball stuff? Or
cleans, like squat cleans, so holding a barbell kind of with my elbows up, and so this stuff gets pulled forward, and yeah, I mean, even with good form, I consider myself to have good form, but it's still just heavy weight getting caught in the front there, so yeah.
All right, any major injuries, accidents, incidents?
I had a back spasm sort of thing when I was about 5 or 6 years, or 5 years ago now, maybe 3 or 4 years ago. But it was, deadlifting issue, and was lifting not even that heavy one day, and I was just felt kind of a twinge in my lower back, and basically had difficulty standing up for a couple of days and a couple of weeks before I was really 100% again. I actually went to a chiropractor there who, I was in Oklahoma at the time, who helped out with that situation. But that's really the biggest major thing. I had some hernia surgery last summer. Just some, meniscus pain in my knee from sports, like college soccer, and so lots of impact stuff. But yeah, that's about it. Nothing too major aside from those things, I guess.
Okay, very good. All right, any ankle stuff?
I've been getting some impingement in my left ankle. It comes and goes. Sometimes it's not too bad. Sometimes like I can't even run without pain.
Okay.
But other times there's nothing there. So I try to do as much stretching as I can to kind of work things out. But yeah, for some reason it just keeps popping up on that side. I don't know why.
Okay. All right, headaches?
Yeah, I would say I get pretty consistent headaches. I'm over a computer a lot, and so that's definitely a big part of it. But it's mainly in that right side. I used to have TMJ issues with my with my jaw, and it was mainly this right side. Working on stress stuff. I don't grind my teeth in my sleep a lot anymore, but I think I still clench sometimes, and so I have some achiness that happens and creates these kind of midday headaches. But yeah, I think it's mainly computer stuff.
A little bit about your work. So are you a PhD candidate right now?
No, I'm assistant professor of social psychology, and so a lot of my research involves writing. Eventually, when you run studies, you got to write them up, and so I kind of get into the groove of pumping out papers, and yeah, it's a lot of typing. And you get into the flow of it. You don't want to stop. You just want to get all the ideas out, and even conducting studies, a lot of them are online, so you're in front of a desk doing those things as well.
Tell me about some of the studies. What are you studying?
So I study kind of the overlap between cultural factors and health. We look at honor norms, and which are prevalent in the South, but they exist in the North and the U.S. as well, different areas of the world, and how it impacts help seeking and engagement with certain health practices. So engagement with vaccinations and screenings. Basically finding that lack of not wanting to look weak in front of your peers keeps people from seeking out various health services in these cultures.
Okay. So when you said honor norms,
yeah. So the term is cultures of honor. The American South is an example, but also if you think of the Middle East, if you think of certain Mediterranean cultures, the idea just being that your reputation is extremely important. In these cultures, it's been studied that there's a lot of repercussions for aggression and violence, but some of my work has kind of pushed that more into the health realm. Not that aggression and violence isn't related to health, but screenings and various health practices a little bit different. So people avoiding these things not to seem weak in front of their peers, something along those lines.
Mm-hmm. So what about on the other side of the coin? We could live in, I would call it an apathy culture now, where it's like, well, no one cares about anything. So what's that going to lead to for health?
Yeah, so the kind of trifecta that we look at is, you mentioned East Asia. We usually see a blend of like what we call honor and face cultures in Asia. But like the northern U.S., we call it a dignity culture, which is essentially that people are born with inherent value, and they don't really earn or lose that. And I don't know if that necessarily leads to the apathetic approach that people have to their health, but I would say that it might help to facilitate some of those attitudes. If you don't have to work in order to attain your social value, then why should I put any work in? Maybe some people are seeing that as an out. I also think just exposure to lots of various methods to escape from having to do the work for maintaining your health, with social media and kind of unlimited access to people who have ideas about, well, we don't need to be doing these things. It makes it difficult to find where the truth is. So definitely there's some cultural stuff that probably plays a role in that, but we haven't investigated that yet. So maybe we will.
Yeah, okay. Thanks for that. Okay. You're clearly in the academic world right now. I can, just by your formulating sentences as if this was a peer-reviewed study, which is fantastic. I really appreciate it. You're making me work a lot harder right now.
Sorry.
No, don't apologize. I like it. I want it. You said people are born with an inherent value and it doesn't change. Okay, that's fascinating. So literally just at birth, or are we instilling that, obviously? Nature, nurture. Let's boil it down to nature, nurture. Where are you on that line?
I would say that the dignity culture idea is that people are born with some inherent value. That does differ from person to person, but it's dictated by things that we agree upon as conferring social value. So things like social class that are kind of passed down. We treat people in poverty differently than we treat people who are middle class, upper class. Those things hold a lot, a different type of weight, I think, in dignity cultures. But I would say also that in that sense, environment dictates a lot about how we interact with each other in dignity cultures. The whole idea behind the honor culture is just that there's a very clear set of cultural norms that dictate how we treat people. If you violate those norms, there's a lot of kickback from that. But not to say that those rules don't exist in some form in dignity cultures. We want to be treated with respect, but also the assumption is that people deserve that automatically, or it should be. That's the tendency, and it's not that way in other areas of the world. So very environmentally driven, I would say, but we'll look at your behavior and we say, okay, do we need to punish you for what you did? Do we need to kind of constrain behavior in a certain way that makes it better for all of us? So I think if you look at cultures in Nordic countries, for example, it's not that people don't get into arguments or that they don't push back against other people, but there's a lot more of a kind of we all agree that these rules are what we follow, and we want you to try and follow these these social rules that we construct. But those are a little bit more flexible in those cultures. So there's a lot of stuff going on, but I find it fascinating to just kind of see the interplay of how we deal with those violations and the pride we feel when we adhere to some of those norms and values and how that reinforces them. So it sounds very academic, but stuff that we deal with on a regular basis, I think.
All right, do me a favor. We've got march in place. Good. All right, looking at the feet and the knees. Pretty stable and strong, straight up and down, no left and right. Good. No, gotta keep going. I'm just gonna say things out loud. Don't worry about me. No genu varum, no genu valgum, no bow-legged knock knees. I see a little bit of pronation, a little bit more on the left. More pronation on the left slightly. Okay, you can stop there and then stand up nice and straight. Good. All right, from here it looks like a high left shoulder, high left mastoid process, and we can see a little bit of rotation to the left. That's good. We'll check that from the rear again too. Let's do this one now, Stephen. Go ahead and close your eyes. Just looking for swaying motions back and forth, front to back. No, you don't sway. You stand still.
Thought you were telling me to.
Yeah, no. Okay, you stand still, and then without even trying, you'll start to sway. Forward, backwards indicates fixations. Lateral indicates hypermobility. You're pretty much just forward straight, anterior to posterior. That's good. Okay, you can open your eyes. Go ahead and turn around and face the other way now. We got some scapular winging going on here. Just a tiny bit, because we had left shoulder was high from the front, but now the right one is high. Clearly. I'm going to put my hands on your hips, okay?
All right.
Good. With a high left hip. Good. Okay, no bowing of the Achilles tendon down here. And the arches are slightly decreased, more on the left than the right. All right, I'm going to look at the glute fibers, okay? You're going to feel my fingers on the back of your hamstrings.
Okay.
And then now we're back to a left eye. Just like that. A little bit of an increased thoracic spine here. Good. And then that most likely indicates a little bit of a decrease in the cervical lordosis as well. All right, let's take a look at the pelvic rotations. Okay, you're going to feel my finger on the back of your hamstrings like this. I'm going to slide up to the bottom of the glute folds.
Okay.
I have to come down because of the looseness of the pants. Good, we're lower on the right. Feet are even, then looking from the top. We're definitely flared on the left. So looking for hypertonicity. The left side is more hypertonic. This could possibly be the PIIN over here, or the ASEX over here. And it just matters if we have a yin or a yang. Hypertonicity on the left or hypotonicity on the right. So do we have an apathetic side? Or is this one honor culture, like, I can't let anyone know that I'm tight, so I just keep getting tighter? Or is it this one over here? It's just like, oh, I don't feel like doing anything today. One of these is the problem. How often do you get back pain?
It kind of fluctuates.
You just need to work on it's like the balance of you. This is like you were a rock climber. This is what rock climbers' backs look like, because they're just like sucked to the wall the whole time. You know what I mean? Too much back, not enough front. It's not really a muscular thing. It really is just a computer sitting posture thing, like 100%. Like you would do well with one of those posture straps that pulled your shoulders back, and then foam rolling this, like every other day you foam roll. Very moist all the way through the center and the lower here. But nice and dry, symmetrical over top of the sacrum. Lumbar spine is a little bit clampy, not clampy. Just excess moisture there. Here. And then pretty symmetrical up here, not too bad. We've got some trapezius. How's that? Is that terrible or what? Not too bad, right?
A little bit of pain there, but
definitely worse on this left side, right?
Yeah.
All right, so we have some shoulder stuff here to work on. Let's see what's happening underneath. It's over here on this side. Is that terrible?
Not too bad.
Left to right, are they the same?
A little bit more on the right. That's definitely the side where I have the rib pain.
All right, let's check the rib heads then. First, let's check the scapula open here. Okay, not bad. All right, first let's check out the pelvis and see if that standing glute test is accurate. Okay, so the right leg is short. That means that high glute is accurate. We're gonna bend like this. Good. Right short stays short, which points to the left side joint, and then your hip really wants to flare when we do it on this side like this. Yeah, that right hip. So the right side was the IN side. All right. Tender here?
Yeah, a little on the right.
On the right. How about we go lower right? Okay, tender here, left, right.
No, not really.
Upper right, SI joint tenderness. Guess what? All right, let's do this now. Go ahead and lift your right leg up in the air. Good, down, put that down. Okay, lift the whole leg up in the air. Good, down. Okay, left, down. Relax, relax. Right, down. Left, down. Alright, so we're going to start nice and gentle. There's more, hold on. Go and take a deep breath in through your nose and out. Nope, we didn't quite get it all the way. Hold on one more time, Stephen. Go in and out. Let the shoulders go. Good. Okay, just following your breath. As you breathe out, I'm going to stretch your shoulders up in this direction and your hips down like this. Okay, let's give it a try. Deep breath in. And out. Shoulders coming up. Good. A little bit more. Good. Can I hear you back? Okay, we're going to bend the top leg here. Let's go to here. Good. It's tender?
A little bit, yeah.
How about that one? Is that tender?
A little bit.
Okay. Okay, we're gonna go like this, nice and gentle as you're breathing. Shoulders coming that way, hips coming down, then pushing in that direction. Perfect. Good. Just sinking. Good, lay on your back. Nice. Alrighty, nice and gentle. We're gonna go like this. I'm gonna bring your head over to the side. Just like the other adjustments, I'm following your breath, and as you breathe out, we're gonna go like this. Good, sinking in, good. One more time, breathing in. Good, you can close your eyes, Stephen. Good, now. Good, right there on that one, good.
Nice.
Yeah.
That felt good.
Okay, nice, gentle breathing now. Left side, sinking. Good. It's testing 7. Good. You're very flexible here. It's fantastic. Coming back up. Good. We're way down at the bottom here. Let's see one and 7. Good.
I'll survive.
Bend your knees so that your feet are flat. Yep. Okay, squeeze my fist in between your knees. Good, bring your feet together a little bit. Good, now squeeze. We're going to do some digestive organ manipulations, okay?
Okay.
Okay, nice and gentle breathing, sinking in here. There we go. A little tender. Yours is pretty, yeah. Not bad though. This has a good tone to it. It should be a little bit tender, but I don't feel a whole lot of tenderness around it. There's a little bit here going up the ascending colon. You guys ate more than 4 hours ago, so you're past this point in the digestive system. You're good with digestion? You have bowel movement every day?
Yep. Pretty steady, I think.
Okay, good. It's all that water you're drinking.
All the water, all the veggies.
Okay, deep breaths into your belly. Out. Good again, in. All right, bend your left knee so your foot is flat. All right, let me know if this gets too hot.
Okay.
Tender in there, huh?
A little bit, yeah.
It's really all right here. All the adhesions that I feel are in this part of the quad. Vastus medialis tendon. Okay, I'm going to adjust the tibia down in this direction like that.
Okay.
Did you feel that?
Yeah.
What did it feel like?
It felt like a little relief almost. I don't know how to describe that. Yeah, like a release of tension almost, a little bit into the bottom of my knee, which I haven't felt in a while. That's been there that tension's been there since I was in college. All they had me do for 4 years of soccer was just roll out my IT band basically, and that did loosen things up a little bit, but you could tell there was something else going on underneath. So that was nice.
Did she tell you about this? You know what's happening right now?
No.
All right, so this is a full spine adjustment. Okay, I'm going to use this towel to support your neck like that. You okay with that?
Yep.
All right, and nice and gentle breathing. I'm going to follow your breath. As you breathe out, we're going to go in this direction like this, and then we pull like that, okay?
Okay.
All right. Good. We'll follow the next breath out and just kind of sink in with it. Nice and gentle. Good. All you have to do is keep your teeth together.
Oh.
Whew. Epic.
Oh, that was a big one. Everything.
Yeah, it's huge. Good. Breathe it out. Take another couple breaths. That's a big deal. That's a big adjustment. You've never felt anything like that before.
No, I haven't.
It takes a minute to integrate. It's the world's most powerful adjustment. It's not standard. All right, just sit up here. Good. Swing your legs off to the side. All right, walk around a little bit. Take it for a test drive and see how it feels.
Whew. It's a new body. Oh, man. Yeah. Feel a little bit out of... like it's not my body, a little bit.
Nice. Out-of-body experience. Cool.
Yeah, but good out of body. Like I'm getting back into it.
Awesome. Put your elbow back against me here. Good.
There you go.
Push. How's it feel?
It's just still acclimating a little bit.
Okay, good. Yeah, thank you. Now, this shoulder muscle that I didn't work on is actually better. Much more symmetrical. It's good. Can't crack your ears. Okay, left and right. Is one of these more tender than the other or same?
Right, a little bit more tense at least.
All right, now how do they feel? Same or still on the right more?
Pretty similar now, actually.
Okay, that's good. How's that jaw? It doesn't bother you anymore? You said a little bit?
The right side jaw does bother me.
All right, lay on your back.
A few years clenching way too hard, and like that right side is where all my TMJ always was.
And then push your jaw to the right. Push your jaw to the left. Okay. Turn this way just a little bit. All right, try to let your jaw relax as much as you can. Good. We're just going to give it a little push here in this direction like that. Okay, let that go. Let that go there. Good. So let's raise this up here a little bit. I know the jaw, it's a hard one to let go, the jaw. You're doing pretty good right there. Just gentle. We're just going to like very gently push in that direction. Ooh, not bad. Good. That side's moving fine.
Yeah.
That's better, but it's just like a little bit at the end. Okay, open all the way. Okay, there we go. Breathe. Breathe through your nose. Okay, it's done. Okay, that'll be tender for a minute.
Yeah. Oh, but it does feel it's not popping as much as it was before. Already.
Swing your legs off to the side. Lots of water, lots of posture, stretching, meditation, all those things, bonus points.
All right, perfect. That works.
Hey man, really nice
Thanks
to
so
meet
much.
you today.
Appreciate
Yeah.
it.